Okay, June, I'm curious about uh, people who are unsure about getting a diagnosis.
Mm-hmm.
Um, Often it is somebody else rather than the person themselves who is promoting the idea of a diagnosis. And I'm just wondering, that's a very delicate situation.
Mm-hmm.
Somebody you love, somebody you care for, there's something the matter with their function, and that they're a bit resistant to getting a diagnosis.
Yeah, that's really common. And a typical situation might be where, for example, an adult son is a bit worried about his mum, and he's seen her going downhill over a period of time. Some of the things she used to be able to do, she's not able to do anymore. She's perhaps burning pots on the stove, or she's having difficulty doing things.
But some of that, sorry to interrupt you, but some of that would be possibly, getting old, maybe becoming a bit clumsy, or
Yeah.
or becoming a bit forgetful. So I could see why she might be resistant to kind
Yes.
of going down that road.
So you see changes happening in a person, and you're not sure what the cause of those changes are. And so sometimes it feels rude to ask the person. It seems really difficult to say to them, I've noticed some changes. But when you're absolutely certain and you want to raise that question with them, you'll quite often find resistance. You'll find them being cross with you, resistant to the idea of, for example, going to see the doctor. And that's really difficult because you don't want to force it. The person's entitled to refuse to see the doctor if they don't want to.
And I have to say, coming in as a psychotherapist, my view there is that resistance deserves some level of respect.
Yes.
Because it's a so as a psychotherapist, I'm curious as to what lies behind the resistance. From your point of view, what is the concern that would prompt people to be resistant to that?
Yeah, I think many people have a very grim idea of dementia in their mind, and research has shown that people are actually more afraid of dementia than they are of cancer, because dementia is seen as having no help and no cure, and dementia being associated with loss of your own power and your dignity and your independence. People see dementia as maybe a descent into something terrible rather than a brave fight against an illness. So the mere thought of starting to talk about it, people find really, really difficult.
So it's almost like they're resistant to having dementia. It's like rather than it comes out as resistant to having the test, but actually what you're saying is people are resistant kind of as people to getting dementia, and that's what it is.
They don't like the idea of the diagnosis. And sometimes you can reassure people by saying, getting a diagnosis early enough, people still work with a diagnosis, they still drive, they still have control over a lot of what's happening in their life. Okay. The loss of control may come much later down the line, but I know people who've had a diagnosis for years who are still operating relatively independently. They can't do some of the things they used to be able to do, but they're doing well. And the other thing is, if you know early enough, there are lots of things that you can do to try and stay as well as possible for as long as possible. But you can't put those things in place if you haven't got a diagnosis. So the diagnosis is not. It's not like a door closing; it's a door opening to something else. That door was closing anyway. If you were getting the dementia, having the diagnosis doesn't make it come on any faster. In fact, it gives you an opportunity to live as well as possible for as long as possible.
I suppose the diagnosis process is one in which you maybe try and work out if there's any other explanation, and I suppose that's why the first part of getting the diagnosis is to work out if there's issues to do with the different functioning of the brain, of the body, the vitamin deficiencies, those kind of things.
Yes, so people often ask me, what other possible explanation could there be for the fact that I'm forgetting things, or I'm getting lost in familiar places and not able to do the things I used to be able to do. And sometimes it turns out that the person is suffering from deep depression. That's something that people can be helped with. Sometimes it's a result of stress. Maybe they've got something physically wrong with them that's stopping them sleeping properly, and that can leave you exhausted and confused the next day, and that could look problematic. There's something called delirium that people get, which is where all the chemicals in your body are completely mixed up because of an infection. or some underlying metabolic problem. So it could turn out that it's your thyroid that's making you different. And so some thyroid medication could put you back at your previous level of functioning. But nobody's going to know that unless you get the blood test. And you don't want to be waiting for a long time for that blood test, because if it's something that could be fixed quickly and let you get on with your life, you want to know that as soon as possible.
Yeah. So I guess the first part of it is that you're clarifying, even before you get into specifics about dementia, you're clarifying if everything else is working as it should be working.
That's right. And that clarification, first of all, you'd want to know if the person is able to mentally perform all the things they used to be able to, and that's where the neurological testing comes in. Then you want to make sure that the blood and everything is, no signs of infection or anemia or any of those things that could be quickly reversed. And at that point, that's when you start thinking, well, is there something happening in the brain? And that's where you'd probably want to look at a scan or something just to see if there's anything really obvious that's going on that can be helped with.
Let me jump ahead to ask a slightly different question now. Supposing somebody has a diagnosis of dementia, okay? Now I know that in terms of brain health, there are various things, various activities that we would encourage people to do. Is it an advantage of doing those things if you've got a dementia diagnosis? So, for example, trying to learn a new language or doing Sudoku, or is it going for a walk? If you've got the diagnosis, are those brain health activities still useful or still valid?
Yeah, it's never too late to start doing things for your brain health, and it's never too early. So encouraging children and young people to do all these things is great for later life health, and there's a lot you can do in middle age. When you're older, there are specific things that make a bigger difference when you're older, but at any point, if you're diagnosed with cognitive impairment that's caused by an underlying disease, then any of the brain health activity are going to help reduce the symptoms of the disease. Nothing's ever going to cure it. We don't have a cure, but there are things you can do to keep your brain operating as well as possible for as long as possible. None of them is a magic bullet. There's no one thing that will make a difference. So there's a whole range of things that you're able to do that clearly make a difference. And there is research evidence for that. In families, for example, there's one family I know where both of the siblings had dementia, and it was inherited, so they were both on the same pathway, but one of them did a lot of brain health activity and the other didn't, and the symptoms worked an awful lot faster in the person who wasn't able to undertake the brain health activities. So there's real evidence that it makes a difference to the trajectory of the illness, as well as delaying the onset, and just being good for you all through your life.
So it helps the person function better at the level that they've been accustomed to. So having an agenda for yourself, like saying, right, I'm going to go to the gym 2 or 3 times a week, I'm going to do this, I'm going to meet these people. All of those things, I suppose the point is, it's never too late. So sometimes think, I've got a dementia diagnosis and everything stops.
No.
But it's the exact opposite from what you're saying.
In fact, people talk to me sometimes about how other people's expectations of them may dip at that point. There was one man who said, the day I got my diagnosis, my wife tried to stop me helping around the house, and that's absolutely not what you should do. You should continue doing what you normally do as much as possible for as long as possible. There's some really basic things you should do. Make sure you get your hearing checked. It seems to make a significant difference according to the research, and we didn't even realise this until relatively recently, that getting your hearing checked
What do you think that's
important.
about? What's your analysis of that?
Well, there's a couple of things. One of the things that happens in dementia is that people have difficulty following conversation. You can make that better by people meeting in rooms where there isn't a huge crowd or a huge amount of background noise, getting people to be clear in their communication. And that's exactly what you do when you're helping somebody who's got hearing loss.
Right.
So it's about helping make communication clear. And when you don't interact with other people, you do get depressed, you do get low, you stop having interesting things happening around about you. So it's the same way that some of the dementia will make you disengaged if you don't resist it.
Yeah.
So will difficulties with hearing. So there's no obvious immediate link. There's one other thing which is perhaps relevant, which is when you have hearing loss, it can be related to something that's happening in your brain.
Right.
And if you have dementia, then there's definitely something happening in your brain, and it could be that they're related. So.
Certainly, as a therapist, the impact of becoming socially isolated is definitely a contributing factor to depression. So if you're in a room and conversations are going on, you can't quite follow what's being said, you do start to kind of feel a bit isolated. You feel as if you're becoming more of an observer rather than somebody who's taking part in it. And that sense of, you hear people saying you can be lonely in a crowded room, and you start to experience that because things are going on and other people are laughing or talking to each other and you're not quite following it. So I can see a direct link between that hearing loss and adding to social isolation, which contributes to depression. And I guess depression and dementia would be quite linked to each other,
There's
would you think?
definitely a link. And so if anybody has been diagnosed with depression in their adult life, then making sure that you keep up with whatever treatment is helping you overcome that depression will help delay the onset of dementia.
That's
really important. And it depends on what your model is, what it is that causes dementia, but there are a number of metabolic diseases which, if you have and you don't manage them properly, they will affect your brain health. So if you've got diabetes, make sure you're sticking to your diet and taking your medication as prescribed. There's a range of conditions.
Diabetes is an important thing because that comes up over and over again. You seem to have there's a susceptibility to dementia linked to diabetes, is it?
Yes, and some of the models that people explore with are models of inflammation.
Right, yes.
Inflammation, there's no absolute science in this yet, but it's quite clear that anything that increases the amount of inflammation in your body, which is why, for example, good air quality, particularly in your later years, is really important. The nanoparticles that you might absorb through, for example, diesel fumes are so small that they will lodge in your lungs, and once they're in your lungs, they get into your bloodstream, and if they're travelling around your body and land in your brain, as your blood will, then that can cause inflammation, which we think may well be related to onset of dementia. So
I've come across this, and particularly extended inflammation, which can be enhanced by stress, continually being stressed, does that as well.
Yes.
Essentially, it means that the cortisol levels and the stress hormones in your body are not having a chance to rest.
Yes.
So they're always working, and that's not good for the brain.
Yeah.
So that feeds into what you just said.
And that would also explain why alcohol and smoking are things that might precipitate or at least accelerate any form of dementia. Why exercise is good, because that reduces your cortisol level, reduces your stress, can help with depression. So a lot of it is about keeping your body healthy, but there are some things that seem to be quite significant according to the research, and that would include uncorrected hearing loss, poor air quality, a diet that isn't heart healthy, because your vascularization of your brain is really important. And it's never too soon to start these things, even maternal health and child health. Sleep is really important, and again, that helps reduce stress if you're able to sleep well. So everything is interrelated, but there are some specific things that you can do, particularly if you know that you're vulnerable. And if you get a dementia diagnosis early, then even if you've maybe been quite relaxed about these things till then, you can actually focus more on them because you know it's going to make a real difference.
I can be cheeky because you and I are of a similar mature age. And I know that I notice things that you do to keep yourself healthy. I notice that you swim regularly. You take up sign language to keep them quite stimulating of the brain. You make sure that I think you've stopped drinking alcohol.
I don't drink alcohol, no.
So I can see clear steps that you're taking to kind of just keep your brain healthy. And is that just because you're self-managing yourself in a way which is promoting brain health?
Yes, absolutely. I want to live to be 90 at least, and I know by the time I'm 90, currently I have a 50% chance of having dementia. So I want to be one of the 50% who's that age and doesn't have dementia. And given that there is research that shows some of the things I'm doing make a difference, then I can't think of any reason why I would not do that. I'm investing in my health because, apart from anything else, having dementia is quite expensive. I have this idea that I'd like to leave at least some of my, I mean, I'm not a wealthy woman, but some of my worldly goods I'd like to leave to my child. She'll be middle-aged by then, but I'm sure she would like to inherit some money.
She'll still find a way of spending it.
She'll find a way of spending it. I just don't want it to be the case that I have to start paying for care too soon, because I think that, apart from anything else, it's more fun being independent than staying at home. I want to do that as long as possible. So that's why things like the evening class to learn British Sign Language, it's a good way of keeping my mind busy.
Great.
Also, I have to be organised and, just the business of arranging the timetable to make sure I'm there. The socialisation I do with the people at the class. I've met a woman there who's really interesting, and we meet for coffee sometimes. So, it's just fantastic, and it's opening my mind to the whole world of a whole population of people who are, who can't hear well, a whole population of people that I've never had any interaction with all my life. And as you say, we are a mature age, so it's incredible how much I'm learning now at this age, things I should have known before. So it's good for the brain.
Let me divert you a little bit, because you mentioned when you were talking there about care homes and how expensive they are. And I guess that's a consideration which people have as well. Care homes are important, and there comes a time for many people when really it's the right option.
Yes.
But it's a challenge for people to face that, because I know that often people have a kind of pact, I'm not going to put you into a home, or you're always going to be welcome here. But I think from your experience, and I know you've told me at different times that that has to be challenged because of what's happening for both parties.
Yes, anybody who's listening now should be having conversations with other people in their family about what they want to happen if something could happen. And in my family, for example, with my dad, 10 years before he needed to go to a care home, we had that conversation where I said, Dad, I really want you to stay in your own home for as long as possible. And he said, absolutely. I said, but I can't promise I'll always be able to do that. And so we had that conversation, if we have to choose a care home, is there anyone you would not like or anyone you would? So when the day of the decision came and he couldn't take part in that decision, I know what he would have wanted if he'd been there to make the decision. He wanted the one that was by the seashore so he could see the harbour and the boats going in and out. So we were able to make that decision. It's one of the most emotionally challenging and expensive decisions you'll ever make, because even though the cost of being in a care home is different in different parts of the UK, in big cities it's even more, but it's not unusual to spend £2,000 a week in a care home. And for me, if I'm going to need a care home when I'm 90, if I just stay out of it for 1 week, or if I stay out of it for 3 months, I'm going to have the equivalent of whatever a 4x4 car costs by that time. This is a lot. These are significant amounts of money. And if by doing things that are actually quite good fun, like going to an evening class or swimming, you can delay the onset, then I think that's definitely worth doing. And in addition to that, the delay, the delay of the onset, I want to know as soon as possible that I did have dementia if it was happening, because there's a number of things that I could put in place to keep myself as well as possible for as long as possible. The medication, as we know so far, only really works in the early stages, and I wouldn't want to miss that window of opportunity, not only to keep myself out of a care home, but to keep myself able to relate to my family for as long as possible.
Yeah. I mean, I think the care home option is worth exploring, apart from the cost, which is important, and the comfort which the person has. I sometimes, when I see media on television, it kind of gets a bad rep. It seems to be represented in an I can see why it puts people off when I sometimes see it, and I'm thinking that feels really imbalanced. I mean, do you have a view of that?
Yeah. Well, the purpose of people who are making television programmes is to grab your attention, and these days it seems it's difficult to grab anybody's attention with anything other than a horror story. And it's absolutely wrong if even one person suffers from a bad care home. But the fact that these stories are brought to the fore all the time means that people quite rightly are a bit concerned. Lots of parts of the UK have care home open days. You can go and have a look at a care home, see what they're like. And in any town, there will be one that is really, really good, and there'll be one that you just don't want to go to. So asking around which ones are good and which ones aren't. My own personal experience with my family was that the care home was just fabulous. It was really, really nice. It was local women looking after other local people's parents, and it was very homely.
Is that what makes it fabulous? Is it because the people in there are peaceful? They're kind of, they're happy with their lives?
Yeah, I mean, on any day there would have been the option for taking part in activities. If you were like my dad, he preferred just to be in his room by himself, and that wasn't a problem. He could come out whenever he wanted to do things, and there was real joy in the place. People able to do as best as they could the things that they wanted to do, and also the sense that this was, the care home was almost like a reward for a life well spent. It wasn't a punishment or being put away. There was a lot of fun there and a lot of care. You sometimes hear of old people who are very lonely in their house, and they're only getting the visit of a carer, a paid carer, 3 or 4 times a day, and a family coming along when they can. Whereas in the care home, for my dad, somebody popped in every half hour. It felt like, someone bringing in his laundry or coming to tidy his room or asking him if he wanted a cup of tea or taking him to whatever entertainment was going on that day. So yeah, a care home can be a really nice place, and so people shouldn't be afraid of it. But you don't want to go there too soon, because you spend your whole life making your home nice, and your home is where you want to stay. People who have got a lot of resources can pay to stay in their own home, but sometimes that works out quite expensive because of the cost, the hourly cost of care. And the time when you're afraid sometimes is at night, when someone might have a fall or might need help in the night. And if you don't live near your parents, sometimes they may be phoning you at all hours of the day and night. And if you're still working, it can be really hard to go to work if you haven't slept yourself, because somebody's been ringing you up.
For people who are staying at home, I was actually watching television last night, and it was a police drama, and this person was sitting on a bench, and the police came along, and they phoned in and said, they got the man's name and said, "Is there a Herbert protocol in place for this man?" And the police sergeant didn't explain what that was, but you just want to mention what that is?
The Herbert protocol is a really good thing for helping people with dementia be free range. It's really good. So what happens is, when someone has dementia, sometimes they get lost in familiar places. So they may leave their house and get lost somewhere in the town, or they might accidentally try and go back to a house where they used to live, or they may just become disorientated. And so when that happens to someone in your family, it's devastating. You're really, really worried. In most cases, in almost every case, the person is found and returned. But that period of time while they're lost is absolutely terrifying. So what's recommended is, after the first time that this happens, you contact the local police and they get you to fill out a form which asks all sorts of questions that you might think are irrelevant, like where did they go to school, where did they work. The reason for those questions is that the person might naturally drift towards those locations when they become lost. And then the next time the person gets lost, which might even only be the second time, you only look for them for 10 to 15 minutes, and then you call the police. And that's the point at which the Herbert protocol goes into action, because it means all the police officers who are in that area are informed that this person is missing, and they can start looking for them really quickly before they've gone very far. Because if you wait 5 hours, who knows how far away the person can be? They've got on a bus, they've got on a train, you don't know where they are. So the Herbert protocol is a really good way of reassuring families that they'll find somebody quite quickly, because the alternative is locking the person up, locking them in the house, and you don't want people with dementia to be locked up. There are other things that can enhance this, like making sure they've got a locator device. They've got an Apple Watch with with Find My on it, or any of the other locator devices that are available.
And so the Herbert protocol, is that something that happens after you've had a dementia diagnosis?
Anybody who's a vulnerable adult who's at risk of becoming lost could be linked into the Herbert protocol. And the reason why we associate it with dementia is because the majority of vulnerable adults who might become lost are people who've already got cognitive impairment. Right. So, but there may well be other people who would benefit from it. And for all of us, who are young or middle-aged, getting used now to electronic devices that track where you are is quite useful. But for the generation now who are in their 80s and 90s, who might have dementia and be getting lost, they're not familiar with those things. So something like the Herbert protocol is even more important for them currently, because they may well not be carrying or fail to carry their phone. I mean, when did you ever see a young person separated from their phone? They get anxious straight away.
Yeah.
So that might last for all their lives and they'll never part with their phone. But
and increasingly now families track each other wherever they are.
Yes,
particularly if you've got teenagers going out at night time, you want to know where they are.
So over time we will be familiar with that, but at the moment the protocol is really useful, and it's really interesting that it's made it into a fictional story. Yeah,
it was on a police drama last night. It was quite amazing.
That's great, because it does help the police if they find someone who appears to be lost to work out what's happening, because it's good.
It falls into that category of different things which can be put in place to help people stay at home. And so the protocol is one of the things, but there's other things around the house nowadays that people, that safety things which are put in place just for those moments that the person maybe kind of loses orientation or other hints and tips which are helpful for people.
So the hints and tips, for people who are at home. If somebody's really interested in technology, there's masses of stuff that is helpful. We've mentioned locator devices. The other thing that is quite useful is something called Just Checking, which is a movement sensor in the house. And so if I have someone that I care for and they agree to this, they can have movement sensors in the rooms in their house. It's not taking a film of them, but I can have a report on my smartphone that says, the person spent 3 hours in the evening in the living room, and you think, well, that was probably watching television, and then there was a trip to the bathroom, and then a trip to the kitchen, and then a trip to the bedroom, and that's a normal pattern of behaviour. So once you know what the normal pattern is, if somebody, for example, makes the trip to the bathroom and they stay there for an hour, you think that's not normal. They're usually only in there for 15 minutes, and that's when either a call centre or the family member can call up and say, is everything okay? And if they don't get an answer, they can go in and see whether the person has fallen there. So something simple like that can help you without having a film. It can give the person at home reassurance that if they did fall and couldn't reach a phone, somebody would soon know that they hadn't moved. So that's one example. Other examples include, we know that lots of older people, because their understanding of inflation is wrong, when they get a £300 electricity bill, they think that's enough money to buy a house. They think that's a phenomenal amount. So apparent, perceived fuel poverty, they don't have fuel poverty, but they think they can't afford it, means they switch things off. And as winter comes, there's the danger of hypothermia there. So having the kind of control where you can control the temperature in your mum's house from your own phone with a Nest or one of these similar Hive items, that means you can check, and if the temperature's getting too low, you can put the heating back on and keep them warm. So there's hundreds of things, lots of websites that will tell you these things.
Nowadays, exactly. From here, I'm not at home at the moment. I can control the heating in my house. I now can actually control my washing machine.
Oh, that's amazing.
And I control my fridge. and because I've got a ring doorbell, I can see if anybody's coming in or going out. So technology now is just there to help us work out what's going on at any time in our house.
And there's another thing you see often, particularly around towns that have a lot of Airbnb, like in Edinburgh, you'll see a door that has half a dozen of those locks in which a key can be stored so that someone can let themselves in and out the house. Much more elegant than that, and actually much more controllable than that, is a biometric lock. So you can get a lock which will read the thumbprint of the person who's trying to get in and out. The lock can take up to 100 prints, which means that if your dad's not very good at remembering which finger he's supposed to put on it, you can have all his fingers on it. That's 10 of your 100 gone, and then you can add the carers that come in, family members. So getting into the house is not difficult. You could say to the next door neighbour, would you mind having your thumbprint as one of these, so if I'm stuck you could pop in and see them.
I think winding this conversation up, I think what we're seeing, what seems to be a theme here is, if you get the diagnosis and start to make changes in your life can be much more manageable without being overly disruptive. You can find ways of accommodating cognitive decline in a variety of ways, and there's technology, there's medication, there's exercise, there's social interaction, there's theory. There's a lot that can be done in order to help the person maintain levels of normal functioning in life.
Yeah, and the diagnosis gives you a focus to know that now's the time we haven't already been doing it, now is the time to start doing this and doing it early enough so that the person who's affected by dementia is able to influence the decisions about what's going to happen next.
That feels so important, that kind of sense of empowerment at a point where people might start to feel they're getting disempowered. At this point, they can have the discussion which keeps them empowered. Yeah.